Business intelligence for public health data. We have Bhami with us to talk about this. Hello Bhami, tell us a bit about this client.
In US, Health and Human Services review the quality of care provided to the patients by the managed care organizations and hospitals together. Okay, we are prepared a dashboard, public patient dashboard, to show the quality of care performed within the state, particularly one of the biggest state in US. We build the public facing portal for them.
Preparing a dashboard for this must have been quite challenging. How big was the project?
So every year they are collecting around 40 million claims to analyze and find the quality of care provided to the patients, and then how they are paying amount for the quality. That kind of information we need to get out of those records. So the challenge is collecting all the claims coming from various parts within the state, and they are submitting on Medicaid. These claims we analyzed, and we built around 60 standard measures quality of care provided. Okay, so these measures are defined by NCQA, and then how it is compared with benchmark within the country and showed the dashboard to the public. Okay, the key challenge that we faced in this project is data security, because most of the measures we are displaying within the public, and then we can't disclose personally identifiable measures in the public portal. So we specifically provided a privacy for the data, and then identified the denominator records will be more than CMS standards. So we applied all the privacy standards related to NCQA and CMS and displayed public portal. Okay. Also, the same portal is used for analyzing the data by Health and Human Services as well as managed care organizations. The security is important, like okay, one MCO cannot see other MCO's data, and then HSS can see the data for every month. So we implemented the security such a way that based on user, the data will be identified and shown to the people. Overall, we had built around 300 dashboards out of 40 million records, and then showed to some dashboards to the public, some dashboards to the MCOs, some dashboards to the HSS. So that's how we had implemented this project.
300 dashboards for 40 million people? That's a big achievement. What were the key takeaways from this project?
The key takeaways from the project is basically the type of data we are getting, multiple sources, and then the processing of the data particularly. Because PHI data is there. PHI means personally identifiable data. So we can't disclose that data outside a particular environment. We build a FISMA environment, which is a standard to the federal health standards, and then within that environment only we process the data, and then we brought out all the permutations and combinations of the reports out of that environment without PHI data. So we need to check carefully and apply the privacy to get the right data to the public. So for that we had spent some time on testing and then identifying any loopholes or anything is there, we need to fix those things. So for that we had worked with the customer team to identify any privacy problems are there.
You have managed data privacy very well. What were the benefits for this project?
The customer is able to provide the report on time to the public because the customer is particularly a quality review organization. So they want to provide the reporting on MCOs and then public reporting portals, things they want to provide on time. So we help them to provide all kinds of standard reports on time, and then particularly it's an interactive reporting, and then they can access what they want. And then we had provided kind of a help, like okay, how each and every measure is calculated, and then how it will be disseminated to the public, how it is sent to the MCOs. So that kind of information is very useful for them to collaborate within the team. Okay, and then it is faster way to communicate within the people.
What was the client feedback?
By the completion of the project, The customer is very happy because seamlessly they are submitting the reports to the HSS. They commented that okay, our services is very good, and then and particularly the privacy and the security that we had implemented within the project is highly standard. That's the comments they had passed on our project.
How did you feel about the success of the project?
I feel proud that okay, we had implemented a very good healthcare project for a particular state, and then this is publicly facing portal and anyone can use it. So many people are concurrently using the project.
Thank you, Bhami.
Thank you very much.
Thank you for watching.